In this video, I want to give you some general information about what to expect or what you should do after getting your braces onto your teeth. And there's three main aspects. We have to talk about pain situation, we have to talk about eating habits, and about brushing the teeth. Let's start with the pain situation. Unfortunately, when we put in braces, your teeth most probably will start hurting for a few days. That doesn't start immediately after putting the braces in, but it takes some hours and then the pain level rises. Why is that? Because we have some pressure on the teeth. We need the pressure to move them through the bone. Without pressure, nothing happens. With pressure, we will experience some pain. The level is different from person to person, but it's uncomfortable in the first days. What can you do? You can take pain medication, of course. Ibuprofen, paracetamol, the normal pain medication that you use for a headache, in a good dosage, according to your weight, of course, and like that you can make it more comfortable for the first few days. Another problem can arise with these brackets. They stick out a little bit and they can irritate your lip. The lip needs to get used to the new surface of the tooth. That's a little bit like with a shoe. When you have a new shoe, it can cause problems over the first few days, and then afterwards the skin gets thicker, gets used to it, and the problem is mostly gone. Same with the lip. Now, with the lip, to help the lip heal, we can do the following. We have some wax here. That's a normal sticky wax. And from that wax, we can take a little bit off, make a little ball between our fingers, and put that ball right over the bracket that causes the problems on the lip. Like this. And now we have a very smooth surface. The lip can slip over it very nicely, can heal, and the problem should be gone within a few days. Second part we have to discuss is the chewing, the biting. Now these braces hold quite well. They hold with about 10 kilograms per bracket. Unfortunately, chewing forces are quite a bit higher, so if you bite onto something hard, you can easily break off the bracket. Then it hangs on the arch wire like here. This one is loose. I hope you can see that. Yeah. If something like that happens, just let us know. We will rebond the bracket, of course. The braces cannot work properly if they are half off. But in order for that not to happen, avoid hard food. Don't bite carrots, don't bite crunchy apples, don't bite hard bread, don't chew almonds, stuff like that. Try to avoid it or be really careful. Chewing gum on your hand is no problem. You can chew gum, just be a little careful so that it doesn't get stuck in the braces, but it's actually no problem. Okay, and then the third aspect is the toothbrushing. You brush your teeth normally like you always do, top, inside, outside, after the main meals. Certainly also after brushing, after eating something, you have to check quickly in the mirror if there's something stuck in the braces. That doesn't look nice otherwise. But then in the evening, you need 2 extra rounds. If you don't brush, well, usually here, between the brackets and the gums, the plaque accumulates and we have problems with demineralization of the teeth. So every evening, brush very nicely in between your teeth and the gums. That's this area, and that would be what you have to do, the movement. You need soft bristles so that you don't hurt your gums, and then you can really brush nicely there between the brackets and the gums. And the other area that you have to brush nicely, which is also different from normal, is here in between the brackets below the arch wire. And you can get there easily with your normal brush. You don't need any special brushes for that. Just go like this and clean that area once a day in the evening. You have enough time for that, so that You won't get any demineralization on the teeth. You won't get these white spot lesions, which cannot be removed anymore. You won't get inflammation of the gums, bleeding, pain, which doesn't have to be there. Just make sure you brush your teeth nicely. And that's it. You have the 3 points: the pain medication, the wax, the chewing, biting, avoid the hard things, and the brushing between brackets and gums and under the arch wire, and then you should be fine.